I want to thank CEMHD, Southeast Michigan Health Association, and Executive Director Danielle Hilliker, who's here going to be one of our moderators today, for welcoming us into this space. I also want to thank Susan Miller, who is development at, and I know I'm getting your title slightly wrong, development at Wayne State University in our medical school. I work with her very closely on the topic that we're dealing with today, which is funding community academic partnerships and engaged work towards health equity. So we're really excited about the panel and speakers we have. Some are in the room today, some are online and are participating off site. We're really grateful to everyone for being here today and for helping us to advance this work. So now I'm going to turn it over to Danielle.
Thank you. All right, I am going to project so you can all hear me in the room, and hopefully you can hear me online. My name is Danielle Hilliker. I'm the president and CEO of Southeastern Michigan Health Association, and we're just so happy to have you all here today to talk about this really important topic and really being a collaborator and connector in this work. I am going to introduce our first panelist, who will provide some background about herself and her work. I believe she is joining us virtually for those of you here in the room. So Dr. Crystal Barksdale is the program director and at the Division of Community Health and Population Science of the National Health Institute on Minority Health and Health Disparities. Do we have her online?
Yes. Can you hear me?
Well, she'll do her presentation in a moment, so that'll be good. I'm Susan Miller. Sorry for the grading lesson. I work at Wayne State School of Medicine, and I'm so happy to be able to work with Haley's team so often. And I am the Director of Research Philanthropy, which really means foundation relations. So that is my job, and I'm so happy to be here tonight. And I hope we can all walk away with new ideas for funding and better strategies to secure funding. So thank you for coming. And I want to thank our two live panelists. And I'm only introducing Katie at this point because I'm going to go in order and honor the flow of the events. Katie Brisson, and I am going to put my glasses on to look at your title, is the Vice President of Program at the Community Foundation of Southeast Michigan. And actually, it's also the DMC Foundation is part of the Community Foundation. So you might hear Katie refer to both interchangeably in a lot of cases, not always. So if you have health outreach programming or research programming, you might be aiming towards the DMC Foundation, other type of outreach and education, Community Foundation. And Katie will give you an overview of their funding priorities and the process by which they give out grants.
Introduce. Okay. Thought we were gonna do presentations one by one. All right. All right. We're gonna keep moving. All right. We also have Courtney Clyatt, who's a senior program officer for Eugene Washington PCORI Engagement and Awards Program.
And we also have Laurie Solotorow, who's the director of Nutrition and Healthy Lifestyles at the Michigan Health Endowment Fund. And the Health Endowment Fund is a great resource for anyone here. They fund throughout the state. And again, Laurie's going to give you an overview of what they fund and their process.
I need someone at the end of the so we didn't ask. So thank you. Thank you for that.
Yes.
That's the only reason we invited you.
So after the presentations, we'll go into some panel discussion and then we'll open up for Q&A. And then I believe we have Dr. Barksdale first.
Okay. Can you hear me?
We can.
Yeah.
Okay, great. Well, good evening, everybody. As I was introduced, my name is Crystal Barksdale, and I am the program director in the Division of Community Health and Population Science at the National Institute on Minority Health and Health Disparities. And I'm just going to talk very briefly about the NIMHD. We use a lot of acronyms, so you'll have to excuse me, but I'm going to talk a little bit about NIMHD and then our funding interests and areas of interest, specifically around community engaged research. Next slide. So to begin with, I just want to provide a little bit of grounding and overview about the National Institute on Minority Health and Health Disparities, and starting with our mission and vision. So NIMHD's mission is to lead scientific research to improve minority health and reduce health disparities. And so to accomplish this, NIMHD plans, coordinates, reviews, and evaluates NIH minority health and health disparities research and activities. That's across the all of the institutes. NIMHD also conducts and supports research in minority health and health disparities. We promote and support the training of a diverse research workforce. We translate and disseminate research information and foster innovative collaborations and partnerships. And so that's kind of most importance, especially for this evening. Thus, NIMHD envisions an America in which all populations will have an equal opportunity to live long, healthy, and productive lives. To achieve this, we raise awareness about the prevalence and impact of health disparities and disseminate effective individual, community, and population level interventions to reduce and encourage the elimination of health disparities. Next slide. So there are a few different definitions and conceptualizations of terms. So I just want to offer a few definitions used by the NIH and NIMHD related to minority health and health disparities. First, in terms of NIH designated populations that experience health disparities, according to legislation to create NIMHD, such a population is characterized by a pattern of poor health outcomes indicated by the overall rate of disease incidence, prevalence, morbidity, mortality, or survival in the population as compared to the general population. And so by definition, by legislative definition, these populations now include racial and ethnic minoritized groups, less privileged socioeconomic groups, underserved rural populations, and sexual gender minorities. And this includes lesbian, gay, bisexual, transgender, and gender non-binary or gender non-conforming individuals. Next slide. NIMHD defines a health disparity then as a health difference that adversely affects the defined disadvantaged populations, those that I mentioned in the slide before, based on one or more health outcomes. And when we think about health disparities research, we think about research that's devoted to understanding or advancing scientific knowledge about determinants that might cause, sustain, or mitigate health disparities, or research that's devoted to exploring how this knowledge is translated into interventions to reduce disparities. Next slide. When we think about minority health, we think of that as the study of all aspects of health and disease in one or more Office of Management and Budget, or OMB defined, racial and ethnic minority populations. So that includes Black and African Americans, Hispanics or Latinos, Asians, American Indians and Alaska Natives, and Native Hawaiians and other Pacific Islanders. Minority health research can include comparative research to examine and understand better or worse health outcomes in a racial or ethnic minority group relative to other groups, the exploration of within-group variation in health, or the exploration of health conditions or risk and resilience factors specific to or disproportionately found in a specific racial and ethnic group. And I'm kind of going over this because, again, this kind of sets the stage for the specific kinds of community engaged research that we're especially interested in. So next slide, sorry. When we think about, next slide. Just very quickly, this is the NIMHD research framework. And whenever you contact a program officer, program director at our agency, or if you look on our website, most likely somebody is going to refer you, or you may hear about this research framework. In recognizing the complex interactions of factors and determinants that may lead to, sustain, or mitigate disparities, or promote or worsen minority health, Scientific staff at NIMHD developed this dynamic research framework that characterizes a wide array of determinants underlying minority health and health disparities research. This is a living tool that's a hybrid of the socio-ecological model and the National Institute on Aging's research framework, and was really developed to help convey our philosophy for minority health and health disparities research and priorities. So it's really something that we've developed to provide a tool for researchers, educators, and others to encourage diverse, multi-level, multi-sectoral approaches to minority health and health disparities research. Next slide. Well, in general, what we like to emphasize is that much of the focus on disparities research, including research supported by the National Institutes of Health, has been either on the single cells of this framework, such as like maybe individual biological determinants, or single levels of influence, such as maybe one row or one column. What we think of is that that might be a useful starting point, but that approach does not take into the complex interaction of structural and social determinants that create disparities and that sustain disparities. Next slide. So addressing health disparities, and as we move forward and really think about especially with regards to mental health, but really any disease or condition, addressing health disparities really requires research that explores factors at multiple levels of influence, particularly those beyond an individual level. And decades of research has demonstrated how research should prioritize an understanding of how community, social, and structural factors, including structural racism and discrimination, impact individual, community, and population level outcomes. And so that's especially where and why we emphasize community engaged research and community engaged approaches. Lastly, I just wanted to highlight just a few of some of our funding opportunities that are specifically calling out community engaged research approaches. I won't go into detail here that have the links included, but I'll note that again, these focus on and emphasize not only community level approaches and community level interventions, but also again, community level, structural level factors. So those factors that are beyond the individual level when thinking about and understanding health outcomes that affect not only minoritized populations, but populations that experience health disparities. So I've included on here I think the parent announcement, which is a general announcement of parent funding opportunity, because we encourage investigator initiated applications, but with the caveat, with the idea that again, it meets obviously and aligns with the vision and mission of our institute, but also again, that it's thinking along those lines of moving beyond the individual level of determinants when considering health outcomes that affect those populations. So next slide. That will be all for me. And I look forward to discussion and answering questions. Thank you.
Thanks so much, Dr. Barksdale.
Now we move on to
Move ahead. So just, so this is interesting because we're going to be completely different type of foundation than you just heard about, but that's the whole point of this, right? So just so my role in the Community Foundation is Vice President of Program, which really means overseeing any of the competitive grant making programs that are open to the public to apply to. And I'll explain, so we also have some funds that are donor driven, where the donors are just going to tell us where they want the money to go, and we help them do that. So I'm on the side of where people can apply. The next slide. So for us, we are a community foundation, which means we're focused on a specific geography. In our case, we're 7 counties. So while we fund many projects that are just benefiting Detroit, we do have a regional lens to our work. So we often are looking like, if we're funding something here, is it something people in other parts of the region can learn from, or partnerships across the region? Thank you.
and, you know, we don't need to go into the money, but I guess I wanted to make a point, we're different than a private foundation, you know, where Kellogg Foundation is just Will Kellogg's money that's invested and it grows over time. We're growing every year with new funds, with donors that set up new endowed funds with us. So we were just started in 1984, which is relatively young for a community foundation in the country, like New York and Cleveland are like over 100 years old. But we're growing, and I say that because I encourage people to like check our website out every year, because we might have something new this year we didn't have before, depending on what donor is working with us. Next slide. So the main thing though is you do not have to learn all our 1,200 funds. We're here to help, you know, to streamline that, and really you'll see in our guidelines, we encourage people to talk to us and we'll kind of point them in the right direction. Now with Wayne State as a partner, anyone working with the med schools, Susan, we have regular meetings with and help kind of shepherd proposals there. On Wayne State, the other kind of side, main campus, Heidi Coates is the person we work with there. But I do know many of the people in the audience, we have funded nonprofit organizations directly as well. But basically across almost all of our grant programs across the board, these are the 4 things we're looking for in almost every proposal. And that is that if we're going to fund something, we know our grants, we're not the grantor that can grant year after year after year. We want to help at key times for a project, where either there's like a one-time cost to get something up and running, get you over a hurdle, or maybe you have a project that's going really well, but you just need to like translate it into Spanish to reach another population, or something that there's those one-time costs that really help you. And then again, on regional impact, you know, we have this lens of, is this a project that the region can learn from? Is it innovative? Is it something, you know, if you try in one spot, it can be replicated somewhere else? We look to see our grants helping you leverage other resources. So that might be like, we are often the private match to public money that's available, or you need a grant from us to prove something works, and then you think there's a funding stream you can go after to permanently support it. Or it might be that you need money to market a program that you have, and we pay for the marketing costs in that first year. So it's those kind of, you know, it's different stories for different projects, but we do kind of look for that leverage piece. And I should say right now, we're spending a whole lot of time looking at how our grants helping people leverage ARPA money. And, you know, we're tracking opioid settlement money and all that stuff. So government money plays in a lot of this too. And then the last thing we want to help promote collaboration between organizations where we can. We don't want to force anybody to collaborate, but if a proposal comes through where it's multiple groups working together in a thoughtful way, it almost always rises to the top of the applications. Okay, next. So in terms of the types of grant programs we have, I mean, our general grant program basically is usually the first door for most people. And again, because of how we were created, we fund in all types of areas. And so while I know this is a group mainly focused on health, you know, it might be though, you have a project that it's benefiting seniors. Well, we may pull from funds we have set up for seniors. We just funded a caregiving project that's working with caregivers and art programs. We pull from arts money we have. So one thing that's great about the community foundation is we can leverage these different funds that have been established for different areas, but that's the main program people come through. The DMC Foundation, which Susan mentioned, when the DMC hospital became a for-profit, their charitable assets spun off, the youth-related assets went to the Children's Foundation, and the adult-related assets came to us. But really the guidelines for that, the DMC Foundation, are the same as I just described for the Community Foundation in terms of what we're looking for. It just happens to be all health-focused funds. But even there, we're moving applications sometimes to other funds of the Community Foundation, depending on what it is. So again, just read the guidelines and talk to us. Special opportunities, what that means is we do have, if you go to this page, we do have some funds that were established with us that do have unique guidelines because of who the donor was and how they wanted it. And just to give you some examples though, like our Hope Fund is for projects that benefit the LGBTQ+ community. I know we funded projects out of Wayne State, and even like when Stillman Center for Children wanted to build out their resources for parents of LGBT youth. That was something we did there. Just yesterday, we announced some new grants we have a fund for caregiver projects. We have a fund for youth sports projects, so again, there's some of these unique funding opportunities and they're all permanently endowed. So we're gonna be in this business forever. So it's good to get to know these funds because it might be, you don't have a project right now, but 5 years from now, you go, oh, right, the community foundation is a fund that does that. And you can come to us. I have to say too, we have one of our special funds is our youth initiative, which, we have a group of teenagers who oversees, we train them in grant making. And they oversee grants every year to youth-led projects. So if you're doing things where youth as leaders, that's what we're looking for in that fund. And our youth committee has been amazing. And actually after the Oxford shooting, our board moved money to them to grant to all youth in the region around violence prevention and other issues. So anyway, so that's something to know with you too. And then initiatives, and we're working on all these words, but so what we call them now, but so everything I've talked about so far are permanently endowed funds that again are things we'll do forever that we keep adding to every year. Initiatives are things where the community foundation wants to be proactive and say here there's an issue in the community, there needs to be a leader, or there's foundations that want to work together, and so funds, often foundations pool money with us. So they may be more time limited, they may not stick forever, but examples of that are with the Michigan Opioid Partnership, which is a group of health foundations, including Laurie's group. Work on the opioid crisis. We have the New Economy Initiative that's supporting projects helping entrepreneurs in the region. We have the Pontiac Funders Collaborative, which is focused on projects in the city of Pontiac. So again, these are, we have 15 active initiatives right now. Our Project Play is our youth sports initiative. So those are things you might check out too, because there's often ways to get engaged beyond grants, like we're often having events or, other kind of educational pieces to those. And then next slide. And then these were just some quick tips that I, had for the, the first thing is unfortunately we get a lot of calls from people who really haven't done their homework, who haven't read the guidelines first, or haven't, and it really it's that second line that they haven't looked at who else in their community is doing similar work. And it doesn't mean we don't need both organizations or both projects, but how are you complementing each other? Have you talked about working together? Are you learning from each other? So, because chances are we're hearing from them too. And so you end up hurting yourselves by not, again, trying to figure out if there's ways to overlap or collaborate. And then the accept when there's not a fit and be honest. I'm just gonna pause and say, we see this as a long-term relationship with organizations. We're not going anywhere. We're here to stay. We are focused in the local community of Southeast Michigan. So we may not be able to fund you right now, but let's keep in touch because again, it might be next year we can, things truly are competitive and it's better to have kind of a co-learning relationship. And then, there's so many projects we see that the issues and the need for the project are clear. But at the end of the day, we also are kind of making an investment. So is the project doable with the budget? Is it gonna progress? So all of those kind of things too, we have to make hard choices, but those things matter. Being clear about potential impact of the project, how many people are gonna be helped by this? Or what are we gonna learn from this, especially ones that are ultimately research? What are we gonna learn from this and how is that research gonna be used? Is what we're gonna be asking. And then grant reports, grant reports are a pain. I mean, ours are pretty simple, but we read those and they do help you next time. They help educate our staff, they help educate our board, and can be avenues to you getting more funding later. And then I just want to note, because I know, many community-based organizations in the room, some of you, some smaller organizations sometimes may not have a lot of staff or any paid staff to kind of do the money management part of this. This again is where collaborative, we do fund small organizations all the time, but a lot of times it's groups of organizations working together that come to us collaboratively and just pick whoever the financially strongest organization is to be the official applicant on behalf of the group. and who we're making the grant to. I know like Community Development Advocates of Detroit, we granted to for multiple organizations, you know, so thinking about things in that way. And I also just want to say, you know, in terms of Wayne State as a lens, like we're only funding Wayne State projects that aren't working with the community. That's I mean, even simple to we help pay for the redesign of the land right at Woodward and Warren, the public space there. We help, you know, made a small grant, help clean that up and have it there so the farmers market could be there now and open it up to the community. Like that was a good thing for us to fund. It was they needed money to clean it up and then they were going to use it in a way that the community could use it. So that, I guess that's kind of a clear cut example, but those are the kinds of projects we love. So I think that's it. Next slide. Yeah, just, you know, follow us and, you know, I think our stories about our grants will help kind of give examples of what else we might do. But again, just because we're in all issue areas, it's good to know that it might not be defined as a health grant. You know, again, if you're doing arts or you're doing homelessness work or whatever, it might be that we point you towards a fund that are doing those things that happens to be good for health as well.
Thank you. You're welcome.
Thank you so much, Katie. We, coming from the community-based world, I think I just appreciate so much of hearing the mechanics of how the foundation works and understanding, you know, what your priorities and those keys are very, very helpful for us. So I appreciate it very much.
Yeah, and I think it's important to, if you walk away with one thing, it's that program officers are your best advocates. And I rely on their judgment and their advice. And, you know, talk about an idea early on with them before you spend the time writing a proposal, even to get that honest assessment of, is it viable for this foundation or not? Be honest, be candid, then everyone can help everyone else.
Collaboration. All right, next we have up Courtney Clyatt, the Senior Program Officer for the Eugene Washington PCORI Engagement Awards Program.
And I think that was Susan who said that you should trust and speak with your program officer. Being in that role, I can very much vouch for that. We do recommend that when people are applying for the engagement award program, that they seek out a program fit call and then also have regular check-in calls with a program officer just to make sure that their project is moving smoothly. And it's really our responsibility to help you to successful completion by giving you technical assistance along the way. So I'll just get started here by sharing a bit more with you about where I work for PCORI. Next slide, please. So as we've established, my name is Courtney Clyatt, a Senior Program Officer with the Engagement Award Program. And some of you may be familiar with PCORI, but I'll just share with you a bit more about our history. We are an independent, nonprofit, non-governmental organization that was founded or authorized by Congress in 2010. We fund comparative clinical effectiveness research, or CER, that engages patients and other stakeholders throughout the entire research process, from topic selection to the dissemination of research. We also support work that will improve the methods used to conduct such research, like patient and stakeholder engagement. To date, we funded about 2,000 or so projects on the research side for more than $3.4 billion. We have projects in 49 of 50 states, with North Dakota being the exception. And then also PCORI is governed by a 21-member board of governors representing the entire healthcare community. And this includes patients as well as clinicians. Next slide. On this slide, you'll find a quote from PCORI's authorizing legislation that speaks to PCORI's purpose, which is to assist patients, clinicians, purchasers, policymakers in making informed health decisions through research and evidence synthesis and the dissemination of research findings. Next slide. So as I mentioned earlier, I'm a member of the Engagement Award Program, which is PCORI's funding mechanism for research support projects. So it's not the actual conduct of research, but it's the opportunity to build and develop skills and infrastructure for being able to engage in research. And to date, we funded more than 770 projects under our Engagement Award Program for about 159 million to 160 million since 2014. The Engagement Award program supports PCORI's engagement imperative and provides a platform to increase engagement in research. That's which we identify engagement as research being the meaningful involvement of patients, caregivers, clinicians, and other healthcare stakeholders throughout that research process. And this slide also identifies PCORI stakeholders, and the graphic demonstrates that PCOR is a subset of comparative clinical effectiveness research, bringing patients and stakeholders together with researchers, which allows for research findings to be more applicable to the interests of the potential end users like clinicians and patients. Next slide. So I'd also like to share with you information about the different competitive funding opportunities we have with the Engagement Award program. And this first award here is to support our dissemination initiatives. The awards can be up to $250,000 for projects for up to 2 years in duration. The intent is to support organizations and communities to actively disseminate PCORI-funded research findings. So specifically from a curated list of PCORI-funded research findings. We do fund projects that are aimed at spreading awareness and increasing knowledge of evidence from our funded research portfolio for patients, clinicians, and others who can use that information to help inform their healthcare decisions. Additionally, we do fund meetings as well with our stakeholder convening support. It's a smaller award of up to $100,000 to fund conferences or portions of a conference. And this funding could be used to convene your members around specific PCORI research findings, or it could also be an opportunity for folks to come together and work to identify research priorities and or create a research agenda. In many cases, we've had a number of groups that are focused on rare disease. They'll start in this place right here. Well, they will bring together folks to identify what are those patient-centered issues or priorities that should be elevated when it comes to research. And then finally, we have our Capacity Building Award, which is generally our more popular award, which provides up to $250,000 for a 2-year period for organizations and communities to build the necessary infrastructure and partnerships to be able to meaningfully engage as partners in patient-centered outcomes research. And there have been situations where folks have started with any of these 3 awards and then been able to take that into either a subsequent engagement award or even a research award for several $1 million. And I think that might be my last slide, but I do know that there's the opportunity for questions later. And so I look forward to continuing to speak with the group.
Thank you. Laurie, last but not least.
Bringing up the latter end of the alphabet. Good evening, everyone. I am Laurie Solotorow. I am with the Michigan Health Endowment Fund. I know I'm not muted. No, you're good. If that was the way to do that, my husband would be all over it. Like, when I was muting of Laurie that you found. I oversee the work that the Health Fund does in nutrition and healthy lifestyles, as well as maternal infant health. So the Michigan Health Endowment Fund was established in 2013, and we operate under a statute which is Public Act number 4. So we came out of the mutualization of Blue Cross Blue Shield of Michigan in 2013, when they went from a nonprofit healthcare organization to a nonprofit mutual insurance organization. And if you really want to take a deep dive into the tax implications of all that, you can talk to someone else. However, what happened with that is that they had a surplus of cash they couldn't hold on to and maintain that tax status. So out of that came the Michigan Health Endowment Fund. And so we have been actively making grants since 2014, so not quite 10 years old. We're kind of looking forward to our 10-year anniversary. Each year we grant around $35 million. And our grant dollars only stay in the state of Michigan. So we are a Michigan-based funder. We have partners from the very tip of the copper country in the Upper Peninsula, all the way down to the Ohio and the Indiana state line and everywhere in between. So we don't have any particular designation for this amount of money goes to this part of the state, this amount of money goes to that part of the state. We really, really work hard to seek and find amazing partners doing amazing work in all areas of the state. So we're a statewide funder. We, beyond our grant making, and I'll talk about this in a little bit, we do some partnership and collaboration with other nonprofits. We have a really, really terrific tool out there called Catch a Fire. Has anyone ever heard of Catch a Fire? No, we did. Yeah, Catch a Fire. That's here for Catch a Fire. Catch a Fire is a web-based assistance and resource tool. So the Health Fund, we fund the licensing for that. And if you are a nonprofit in the state of Michigan doing any work, even if it's any tiny bit in the health space, you can have a free subscription to Catch a Fire. And the reason, what Catch a Fire is, I'd like to describe it as a match.com, but for nonprofits. So I know this is not, so I think that's probably pretty accurate. What it does is it matches nonprofit organizations with resources that our professional volunteers from all over the country. So folks who on LinkedIn have designated, I would like to volunteer my time to help a nonprofit with marketing, with development of a annual report. We need something translated from English into Spanish. What happens is you put your project into Catch a Fire and these volunteers bid on your project. So, and you interview them and you say, hey, I'd love to, work with you. There is, the only cost to you is your time investment, and you get to choose. So let's say Katie bids and I bid and Susan bids, and you think, Laurie and Susan are like, well, we really like Katie. So that's, you pick Katie and Katie will help you with, so it's I feel like the feedback has been really, really positive. Folks have gotten a tremendous amount of return on their investment of their time and help with things. So we can talk a little bit about that in a while, but Catch a Fire has really been something I believe that our grant partners have found to be an incredibly useful investment. Next slide, please. So the 2025 goals up until 2025, our goals are focusing on the things that you see up here. So we are a healthcare organization. Well, not healthcare, but we're a health. It's literally our name. Health is literally in our name. So we focus on the things you see up here in terms of access to services. So if folks in a particular region of our state, particularly those in a rural community and underserved community, we focus on working to remove some of those barriers of access to care. Sharing knowledge and bridging health equity gaps, the same thing. We have some incredible partners who are really, really working hard to increase access to healthcare and make sure that everybody has the healthcare that they need and deserve. Advancing integrated care, one-stop shopping for healthcare, right? So how many of us, I know I have, you go to one doctor and they refer you to another doctor, and you got to go to another building. You got to figure out what they can do over here, right? So, a lot of our partners are working very, very hard on what comprehensive care within one organization or one building. Sharing knowledge and learning, we love that. Our partners are incredible. They know so much, they've lived so much, they have so much experience in the communities they serve or the populations that they serve. So, we're always asking ourselves, what can we learn from this? What can we share? How can we more broadly share that learning with others? Increasing efficacy and cost effectiveness. So that really is not, making more money for organizations, but really, really understanding how to best utilize the resources that they have. How can we sustain those resources? And then finally, health workforce and nonprofit community. Those are strengthening those areas. So the health workforce, many of us know this to be true. We are sorely lacking in behavioral health service providers. We are sorely lacking in birthing support, doulas and things like that. So we're, our partners are working really hard to strengthen that. And then also the nonprofit community. Slide, please. So these are the grant making areas for the Michigan Health Endowment Fund. As you see, we have 6 listed up there. Maternal infant health is not listed up there. And I'm sorry to say, I don't know what that is, but that's another area of our grant making. Behavioral health, what you see here is the time that the grant cycle opens and the award amount for that. So we usually just give a general time, winter, summer. But if you go on our website, you will see, dates around when those grant cycles open. For example, right now, behavioral health and nutrition and healthy lifestyles are open grant cycles. And maternal infant or healthy aging will open up in the summertime, probably around early July. The community health impact grant round is a rolling grant round. So you see that May, August, and November are when they are accepting applications. And then also maternal infant health is towards the end of the year. The other one, special projects and emerging ideas, that is our invitation only grant program. So what that means is we generally have conversations with statewide associations, the Department of Health and Human Services, certain health departments. It is really an opportunity for the health fund to partner with larger statewide organizations on some quite unique, compelling projects. So a great example I have of that is a number of years ago, we partnered with the Department of Health and Human Services along with an organization called Sevilla to redesign the application for assistance. So if anyone needed to fill out the application for assistance, whether it was SNAP benefits, any type of benefits to which folks are entitled, 66 pages, folks, 66. That is a lot to ask of anyone. So what this project did through our partnership with Sevilla, it reduced that application down to 16 pages. Redesigned it such that it was a little bit more user-friendly and easier to manage for folks. So those are the types of things we want to achieve in the Special Projects Emerging Ideas grant round. I think that I just wanted to kind of add, I think that Katie did a beautiful job of suggesting some tips for funding. I can't stress enough, understand, the scope of the funding and do your homework before you seek out a grant with the organization, with our organization. Our grant process is, we have an online grant portal. It's called Flux. It is, I think, pretty user-friendly. I always say if you can shop on Amazon, you can put an application in Flux, but we have some amazing folks who help folks with making sure that they get their applications in. Our process is extremely iterative. So what happens with that is you will submit a grant application. We will review it. We have some questions. We'll send it back to you. Susan, please, so does Lisa. We'll send it back to you with our questions. You have a week to provide those clarifying questions. If I still don't get it, I'm going to call you. Please say, Lisa, I still don't get it. How do we understand, what this part of the project is? Because that helps us, as Katie said, those of us on the program side. It is literally our job to make you successful in your grant seeking efforts. That is why we are there. So if we don't understand what you are, what you're looking to do, we make sure that we clarify that. Since this is a group of community-based folks, I just wanted to give a shout out to our community health impact and capacity building grant round. And Megan Murphy, my colleague who oversees that, is out of town, which is why you're all stuck with me today. So, but that is really an opportunity for us to engage with and support and promote community-based work. And it was interesting because yesterday we had a board meeting in the Durfee Innovation Center. And we had a grant panel there, and Genesis Hope and the Island View neighborhood was there, as well as the American Heart Association and a couple other organizations. And one of them said, when you're working in the community and you're a small nonprofit and there are other small nonprofits, she said, it's like the Hunger Games, trying to get some funding, you know, from the same funding source, whether it's our foundation, Katie's foundation, any of those things. And it really resonated with me. So what we're trying to do with community health impact and collaboration is to promote and encourage organizations to work together in collaboration where it makes sense. Right. So when you have a few organizations who are hoping to do the same thing within the community, to the extent that you can collaborate and work together, that is really, really an advantage to, you know, to us from a funding perspective. So think about that. And somebody joked about, you know, with Janine Hatcher, who is from the island or the Genesis Hope, she said, I can get 3 churches to work together. That is really, really big. So really faith-based organizations. So think about that. Think about community representation. Think about, you know, collaborative efforts where they make sense. And that's it.
Thanks, Laurie. I was gonna ask you if that was my girl Janine who asked that question.
It is your girl. She's amazing.
She is. And I will say, Catch a Fire, as a user, I actually was the first year that the endowment fund rolled it out, was part of that group. And it's just been an amazing asset to every organization I've been involved with. They have redesigned our website, created a CRM for us, helped us with logos. So we've just had some great support from volunteers across the world, beyond the country, across the world, that has really supported our work. So if you have some time, do some research on Catch a Fire and get involved in that. So
What did they get out of volunteering?
So the folks from, it's, you know, it's just, they want to give back, right? So it's folks who work at Google, folks who work at Microsoft, and, you know, other very large corporate environments who have decided they'd like to give back, and they have indicated as such on LinkedIn. So Catch a Fire has a partnership with LinkedIn and will engage those folks. So there's, you know, really nothing in it for them other than the ability to give back and volunteer their time. And it is, I mean, it 100% free to all of you. So there's no hidden cost. There's no, oh, now you got to buy a subscription. Nothing. It is 100% cost free to any one of you who are interested in using it.
and you do get to help to, you know, identify the volunteer who's going to work on the project. You really do match up with the person who will, you know, be the best fit. And what's neat about it is you'll see the financial investment, the in-kind investment that they've actually put the time into. So it's, you know, a small nonprofit who would have paid, you know, someone 30,000, 40,000 to redesign a website is now getting that service for free.
And that's a good budget line item on grant application.
Yes, absolutely. So, all right, thanks, Laurie. All right, so we're gonna go into some great questions. I'm so glad you kind of led us into that with your last comment with Janine and Genesis Hope. So I think at this point, you guys can just jump in and whatever your heart compels you to answer. So the first question we have for our panelists, how does your organization establish your funding priorities? Anyone?
Should we stick with the same order we use for introductions, alphabetical order, to make it easy? Everyone feels.
Yeah, that's what I think too, yeah.
Okay.
So Courtney, please feel free to jump in.
Oh, Courtney or
Anyone.
all right. Well, I can
Crystal first, and then I can jump in
Sure.
after you.
Sure, I can jump in and start. So we NIMHD establishes funding priorities in a few different ways. One, we listen to the researchers and kind of the community, research community, the community that we fund in terms of kind of what is happening. And so that's why a lot of what we do is talk with, when we have kind of technical assistance calls, we really, program officers and program directors really kind of take note in terms of what are the questions, what are the issues. We host workshops around a lot of kind of hot topics, if you will, to get a sense of what are the pressing research questions, what are the pressing issues that warrant additional research and need kind of additional attention. So we get a lot of feedback, if you will. I think we try to get a lot of feedback from the communities we serve, and I'm using community in a broader sense in terms of the funding, the funding communities that we support. So be that researchers, community organizations, etc. Some of that we also serve the public. And so again, being a government agency, we also serve the public. So some of that comes from the public as well, in terms of the taxpayers, in terms of what are the issues. So take, for example, COVID. COVID has been a very pressing issue in terms of some needing some additional research around issues related to COVID. So some of that also has informed our funding priorities as well. And then legislators again. So again, we're a government agency. So there's a number of factors that kind of go into shaping our funding priorities.
I mean, yeah, for us, I mean, I think honestly, feedback from our grantees and applicants has definitely driven us to lift priorities when we see a number of applications in a certain space going, okay, something's going on here, because we're getting a lot of requests around this. And of course, our staff's always trying to track demographic changes in the region and all that. I would say, though, the other thing for us is what is a good fit with our foundation. And by that, I mean, like, for example, we've done a lot in helping build greenways in the region and, bike paths, and because we cover 7 counties and many times those projects cross city and county lines. The Joe Louis Greenway that's coming up, we're going to be managing all the maintenance funds for. So that's a good fit. Whereas sometimes, like, for example, some things that are specific to Detroit public schools, we do fund things there, but we really have followed Skillman Foundation and gotten their advice, because they're focused only on Detroit and only on kids, right? So we're again 7 counties. So what's the fit?
Is Courtney still?
Yes, I'm still here. And so for PCORI, following our reauthorization by Congress in 2019, Congress identified that 2 of PCORI's national priorities should be health topics of maternal morbidity and mortality and intellectual and developmental disabilities. And so those are 2 key platforms upon which we have set a number of funding opportunities. Additionally, when it comes to identifying our national priorities for the next few years, we do usually have a public comment period where many stakeholders have the opportunity to provide feedback to PCORI about things that they think we should change or what we should focus on. And then in terms of upcoming funding opportunities on a cyclical or yearly basis, those are often determined through calls and roundtable events with numerous stakeholders. Also through our Horizon Scanning program, looking at some emerging research in the future as well.
And for us, Public Act number 4, the statute under which we operate, really prescribes our areas of grant making. So it calls out 8 areas of funding: infant mortality, health services for foster and adopted children, access to healthy food, wellness and fitness, health-related transportation, health-related technology, infant mortality, food and foodborne illness. So I think that's 8, all right. So we've been, kind of funding under those topic areas since we began. More broadly, healthy aging is one of our grant areas, nutrition, healthy lifestyles, as I mentioned, maternal infant health, and our community health impact and capacity building. So those are areas that from the beginning we knew were underfunded in the state of Michigan. So that's kind of one way direction that we go. And then the other, as Katie mentioned, we sort of listen to not only the landscape, the funding landscape, but also our grant partners and what their needs are. So, we've always funded under health, of course, because that's what we're all about. But we also are acutely aware that healthy nonprofits build healthy communities. So, which is where the capacity building and community health impact part of our grant making came to be. So every 5 years, we go through strategic planning. We have stayed the course for most of that time. And I suspect that we will, because those are areas that are definitely in need for funding. But so a couple of areas, again, feedback from our grant partners, the communities that they are serving in which they live, the Public Act number 4, and somewhat what are health issues in the state. The behavioral health is a great example of that. Health services for behavioral health have done nothing but, the need has increased. So we're very aware of that and working to direct our funding in areas to address that need.
All right, the next question is, and I'll try to speak loudly enough that it picks up on the microphone. Why are strong cross-sector partnerships, a hospital and a church group, an academic institution and a food bank? Why are those partnerships so important in your funding opportunities?
Yeah, so I think for several reasons. I think one of the reasons I think that we found is that it enriches the science, it enriches the questions that can be asked, it enriches the methodologies that are used. It enhances the approaches, it enhances obviously the results. And I think most importantly, it improves the impact of the research, right? And that's kind of ultimately one of the goals of what we're hoping to accomplish is, improved impact, and certainly improved impact in reducing disparities, health disparities, and advancing equity. And so, I think what we've seen and why we're so supportive of certainly multi-sectoral partnerships, and that's a kind of a crux of the research framework that I was mentioning, is not just kind of multi-level interventions and multi-level research, but multi-sectoral research, is because that's kind of what we found. What we found is kind of the key to being able to truly more effectively impact and address health disparities. And so, again, I think it broadens the perspectives that are at the proverbial table, if you will, in terms of coming up with solutions that can truly make a difference. And when you have the same voices, when you have the same perspectives at the table, we get the same kinds of solutions, the same kinds of results. So I think kind of most importantly from our perspective, from my perspective at least, it really helps us to be able to improve impact. And that's certainly something that we want to keep advancing and keep promoting.
She said what I was gonna say 10 times better. Yeah, diversity of thought, right? Perspective, yeah.
Anyone else have a different response to that question?
It's not different, perhaps to add to it, but I know that at PCORI, we are seeking that researchers aren't just trying to do research on a particular group, but they're actually partnering in research with the community members. So we do require that there are letters of support from community members to say that we have had or know about this project, or we have had some part in developing this project or developing research questions. That for us helps us to see that there is true engagement or interest in working with community members. And then we also in in our proposals, we do ask folks to share how they plan to disseminate the information or the findings from their projects so that they can share that back to the community members who have been engaged in the project. Other things that we require include stakeholder compensation. So recognize that somebody should be compensated for their time, just as you're compensated for your time as a researcher to do this work. People are giving of their lives, you know, they could be doing other things, and it's important to show that you respect their time and that you respect them as individuals who are experts and have expertise in their own lived experience.
Yeah.
So well said, Courtney. One thing I was going to add to that is trust. There's a big trust factor, right, with, you know, community-based organizations or large health systems that are serving one particular community. So I think for us, a lot of that implies that there is trust within the community, trust within, you know, the folks who are being served. One example I have of that is the American Heart Association's Change Check Control program. So they applied to us, I think it was in 2018, in a partnership with Second Ebenezer here in Detroit around blood pressure checks and you know, nutrition counseling and things like that for church members who may be concerned about their blood pressure. Not enough to go to their care provider and talk about it, but they're talking to their pastor about it. They're talking to their best friend at church about it. And so they, the American Heart Association recognized that this partnership might be a really great way to engage the community in a safe, comfortable, and trusting environment. And it went so well that the second iteration of that expanded with a nurse partnership with Henry Ford Health, and also with 6 additional churches, very large congregations in the area. So I think for us, that sort of collaborative, maybe a, you know, one that you wouldn't at least expect in a community can really go a long way. And I think that's, you know, one of the things that we've seen time and time again, no matter where we are in the state, to work incredibly well.
Yeah.
Definitely.
If I could just add one thing too, I think one of the things that Courtney mentioned was kind of the things that they look for at PCORI in terms of engagement and kind of what that means. And I think we at NIH, we talk a lot about kind of, well, what is community engagement? And I think that was one of the questions. But kind of, you know, really thinking, being very careful and thoughtful about, you know, what does that mean and what do we look for? What do we mean when we're thinking about cross-sectoral partnerships and community engagement? You know, I think it's also too, you know, thinking about the length of the partnership, right? Not just, you know, that they kind of come in and come out or come in for the purpose of this particular research opportunity, but that there's really, you know, some sort of evidence, if you will, that there's really a sustained partnership. And so sustainability and evidence that, you know, there's some kind of true relationship, true partnership. Is something that we tend to look for as well, or certainly are looking for and considering as well when we think about engagement.
Thank you, Crystal. So I know we have a long list of questions. I don't think we'll do them all.
At
But
7:45, we'll shift to audience
Yes.
questions.
Yeah.
So there will be opportunity for you to ask questions. as well.
absolutely, we'll cut our questions short so you all have the time. Next question. So I know we talked a little bit about the important role that program officers play within your agency. Do you have any recommendations for how applicants should navigate the conversations or pitch ideas or programs within your agency specifically?
Yeah, that's a great question, and I love the tips that my fellow panelists offered, and so I would certainly reiterate those. I think one is perseverance. Be persistent. We're not trying to ignore you. We're busy, and so don't mind repeated emails. That's just the name of the game. But do your homework. I would certainly reiterate that. kind of, share your aims, share your specific aims, or certainly an idea of your concept, your research concept. Provide some information, some kind of context about what it is that you're interested in doing, so that we have something to react to. And again, I think that comes with kind of coming in prepared to the discussion. But I think the top is just kind of be persistent, do your homework. And then engage, engage with us. So again, we get a lot of calls, we get a lot of emails, we get a lot of interaction from a lot of potential applicants, and then current grantees, current grantees. So I think it's a matter of kind of knowing, okay, here's what I'm asking for. I just would like some help in kind of navigating this, and here's what I'm thinking of doing. So kind of arming yourself with some information ahead of time, I think would be helpful, and being persistent.
I just wanted to, on this question, I mean, I talked about for us, read the guidelines, make sure there's a fit, and then talk to us, but specifically on collaboratives and, especially community academic partnerships. I really liked what Courtney said about, I guess for us, when we're looking at a budget, if we say that the money is just going all to the professor's time, we question, is this really a community partnership? Shouldn't some of it be going to the community partner, the people doing the project, so that the budget tells us a lot? But even on the initial calls or meetings, it's very powerful if it's the partners coming together to talk to us. That says right away, like, they're working on this, whatever we do, and versus somebody calling like, is this something you would fund? Well, if so, I'm going to go talk to these organizations and see if they want to do it with us. Like, well, you should want to do that regardless of us, right? So just wanted to add that.
And Katie, to your point, at PCORI, we do also have a bit of a cap, at least with the Engagement Award program, of how much of the funding can go towards personnel, because we recognize that, again, folks should be paid for their time. Your community members should be paid for their time. But to get back to this question, so I think I mentioned before that PCORI does offer program fit calls. And so also to share that we do also provide folks, when they contact us, with an intake form where they can share like what their specific aims are. I think the key things, as Katie and Crystal both said, you need to read the guidelines, you need to read the funding announcement and be familiar with it. It is also helpful to have a sense of, if you have a particular health issue that you're focusing on, to look at our portfolio. It's available online. Look at it and determine if we've already funded projects in that area, particularly around maternal mortality and morbidity. That's a hot topic right now. And so, yes, we may have funded something in the same area you may be focused on, but is it a different population? Are you approaching them in a different way? Is it faith-based? Is it just a school-based even? And so when people are also able to make those certain distinctions between how they are different from what we've already funded, that gives us the opportunity to have a sense of like, okay, well, yeah, you could be a good fit for the project. Generally, because PCORI does fund research that is focused on PCORI and CER, we do remind folks that it's important for them to have that connection to patient-centered outcomes research / clinical comparative effectiveness research, ensuring that it ties back to or eventually can get to what those two types of research are.
And similar to that, when we release an RFP, we always have the opportunity, there's a link in there for office hours. So we set some times and dates aside where folks can sign up, just through the click of a button on the link, sign up for a 15-minute conversation with the program officer for that particular area. Also, we encourage folks to submit concept papers, a 2-page concept paper. So nothing fancy, it doesn't have to be perfect. I always say, you know, just use big fancy words, just tell me the who, what, where, when, how, and how much. That way I can read it and take a look at it and give you ask you questions or give you some feedback on how to strengthen your proposal. So there's a couple of ways that we, you know, kind of have formally give folks an opportunity to do that. But as my colleague said, just email us, reach out. You know, sometimes you have to email a couple of times because we have a lot of folks who are reaching out to us, but we always want to hear from you. We will always respond and always, you know, hopefully give you helpful feedback.
I would recommend doing that concept paper. Nobody has enough time to write full proposals that don't have a high chance of success. It's a remarkable thing to write a 1 or 2 page concept, get feedback. Sometimes it's coded, it's going to be a highly competitive round. And I can read between the lines and say, this might not be the strongest proposal we've ever had, but I would encourage that because it saves a lot of time. I think we're going to make the executive decision. We're not you're an executive, I'm not executive, but to switch to audience questions now to make sure that you have time to ask questions that are important to you. So there are going to be questions that I think Alex is looking at. You're both looking at, sorry about that, on the chat, and they're going to read them aloud as they come in. And also, you know, you have a question, just raise your hand and try to speak loudly so that the microphone will pick it up. So let's open it up if you have specific questions.
Now, do we have any questions?
There is one question in the chat, and if it is short enough, I'll have the panelists or moderators repeat it. But this one, I think I can hear myself as I'm talking, so I think we're okay. So for Crystal specifically, do the current community-based grant funding announcements cover all types of grant programs, R1, R21, R3? And for this side note, by the way, I'm so glad that NIH is focusing on community-based research.
So I barely heard you, but I saw the question in the chat. So thank you. Thank you for the question. So no, they don't actually. So the current community-based programs that I've listed, most of them are R1s. The bigger grants. There is one, the Exploratory and Developmental Research Grant Program, that's an R21. NIMHD mostly funds R01s and R20 and an R21. We do have, and of course we have some career development awards. We fund career development awards, IKs, and, you know, training awards. But the ones that I have listed are R01s.
Any questions? Yeah.
Thank you all for all of the great advice that you've given. Touching back on the discussions about engaging with the program officers and them being the best advocates. And I'm interested in understanding advice and guidance on how to get questions answered if it's a funder that says, please don't reach out to the program officer. Look at the FAQs and, you know, those types of situations. Is there a next best strategy on trying to?
Yeah, I don't know if there's a best strategy. Susan probably would know better than I do, but I almost listed, I mean, there are foundations, particularly corporate, a lot of corporate foundation offices might only be 1 or 2 people. And some of them just, or some family foundations that really are all volunteer family members that really don't take questions. So they do exist. I don't know beyond, I mean, Susan, if you advise beyond reading the guidelines carefully and also looking at what grants they've made, I think can be a good lesson too, but.
Yeah, I think it's tough, especially for national foundations and international foundations. Usually they make you the best I've seen is just a concept paper. Very few will let you get through to a program officer. I wish that wasn't the case.
Thank you.
Yes. You want to go first and then we'll move to you?
Just to piggyback on what Lisa said, I have found that in applying for grants online, there's that phrase, we will only communicate with you via email, via, online. You have to fill out the application online. And then there are some where as you start filling out the application, it does ask enough questions where they will get a sense of who you are, what you are about, and why you are applying for a grant. Then there are others that ask questions, and as you answer them, it's like, I know this is going nowhere. You absolutely know that because they don't ask you enough information to know anything about you. And you never hear from them again. And that's very discouraging.
Are there character limits? If not, you put in as much as you can into each response.
Well, some yes and some no, but what you just answered, the questions are like your organization, the contact person, when is your event or whatever.
That's when those relationships are.
I was gonna say, no, I don't know the case, in that case, if there was someone to talk to before, but I can tell you, we do say, read our guidelines and then call and talk to us, and we'll have calls with people. The applications that come in, you can tell who's talked to somebody and who hasn't. Sometimes we get them and go, I wish they had called me because this could be a proposal, but that's gonna be a hurdle for us. Or we've had a situation where we had talked to them, knew it was a great project, and they really didn't write it up very well, and we've actually gone back to them and said, can you rework this section? Because we think our board, it would be better if they understood this, what you told me on the phone. So that is where it really does matter. It could be, sometimes, we'll just have a 15-minute phone call with someone, they'll tell us what they're applying for, and we might just have 1 or 2 pieces of advice for them, but it can make a big difference.
And then just to chime in, sometimes you will submit a proposal or a letter of intent and it's unsuccessful. I know at PCORI, we do allow for folks to request feedback. And we do expect that if they get that feedback, if they're going to apply again, we actually refer back to the feedback that we provided them previously to make sure that they have adhered to what we've suggested, ways to improve either their LOI or their proposal. So, not that you should just apply for every single opportunity you see. I think you should curate your list of who you apply to. But if you're not able to get in touch with them prior to the application process, maybe even consider just, kind of throwing the spaghetti at the wall, see if it sticks. If it doesn't, requesting some feedback from them. Sometimes it takes getting in front of other people for them to get a sense of what your idea is, for them then to respond to you.
I think we have one more question.
Well, I do have a question, but I want to comment in regards to what Laurie said in regards to collaboration. Because I know locally, there's a lot of nonprofits, and some of them, they appear to duplicate the same thing. Their mission or their goal may differ just a little bit, but sometimes the bureaucracy and people wanting to do their own thing in their own way, that collides. But in regards to what she was talking about, when I talk to some nonprofits, they talk about they can't get the funding, but this particular nonprofit that's been around with the well name, they can get the funding. So how would one who been out there in the community doing the work, and they say, you know what, let's try to do a nonprofit or for-profit thing. And they try that, but they say, well, the funders may say, well, this particular nonprofit is doing it, why don't you collaborate with them? But, the mission may be a slightly different. So how do they deal with the people who've been around with the reputation, who usually get the funding? So, what can they do? What's the process in doing this and getting
Such a great question. Yeah, no, that's a great question.
It is a great question.
Yeah, and we've talked a lot about that question in our panelists because I come from that world of small community-based organizations, and it is a very competitive world where we see the same organizations get funded quite often. It's discouraging, right? Especially when it's not reaching the neighborhood associations and those small, community-based organizations that really do the frontline work for so many communities. So yeah, I appreciate that. Yes. Response. Sorry, I had to
chime in.
No, yeah, that is a great question, you know, I know that at the Health Fund, we've been really trying to be really cognizant of that, so that is actually, in all honesty, the purpose of the Community Health Impact Capacity Building grant rounds. So it is not, if you are a $10 million organization with a very recognizable name who wants to do XYZ in the community, that is not the grant round for you, right? The grant is the grant round for smaller organizations that we may not have heard of. It's such a delicate thing, right? Because who am I as the funder to tell you who you should and shouldn't be working with, right? Who am I to suggest that, boy, you can't have this funding unless you partner with, you know, organization B, A, B, and C, right? Otherwise, no deal, right? Not at all. So I think that's the part where that listening and that communication and that kind of back and forth, you know, conversation for us to have. I would say I wouldn't ever shy away from applying. You know, we don't ever say, oh, yeah, you're too small, you're not, you know, right for this. Not at all. I think the opposite of that is true. Oftentimes it is, you have a very deep rooted understanding of the community that you're serving, what that community needs, and what you need in order to make that happen. So I think, unfortunately, sometimes the process itself lends itself to exactly what you just described. But I think to the extent that you can think about having a conversation with the program officer or the people and the foundation themselves who are open to hearing that is just all the better for us and for you.
Well, that's why all of our presenters are here tonight too, to give everyone a chance to meet them, to hear them talk about their programs directly. And that's why it's so great that all 4 of you volunteered to come in and meet people like you doing the work.
I just wanted to know, how often do you all get out into the community to actually do something like this? I mean, to get the group we have together right now, this is like, you know, dynamic. Look, we need to have hundreds of people in the room, right? I mean, is there a certain ask to be made? Is there something you do on a regular basis that the community may or may not know about? I don't know.
We're doing it all the time. Yeah, I mean, a different staff to different audiences, you know, like we have a person who just does our arts work, or a person that does our environment work. And we appreciate, and in fact, I think like we did one for the larger Wayne State community.
Yeah, both of you have.
Yeah, too, but yeah, right now I will say with COVID, a lot of them were virtual there for a while. It's been, but we were just talking, all of a sudden there's lots of getting out and events again. I haven't never made it to my office, but I've been going since 7 o'clock this morning, all day, all over the place.
How would community organizations know where you would be? I mean, if there's someplace they can.
You just have to ask and we will show up.
We can ask you.
They're just saying, hey, we're having this event. Would you like to participate? Would you like to join us? And you know, I had a grant partner who was actually joined one time and said, don't tell Laurie about it because she's gonna want to be there, right? So as you know, as often as we can, as Katie said, we're out all the time.
Yeah. It saves us all time to have these conversations.
We have one more question.
It's like in a hub, though. It's in a hub. It's like in a certain hub. It's not flowing from me. So I'm glad she raised that for me. You know, you guys, I'm sure you're out there visible and busy, but I'm just saying, it's just, yeah, I hear you, but it's just, I just don't think it is flowing out. I think you're there, but maybe not there. So I know you can't be everywhere, and I know that it's, the information, they say it's out there, but sometimes it just doesn't get to some people who really need it as well, you know?
I agree with you. Let's chat when we're done.
Message received.
Yeah. Well, we're trying to make it better by things like this.
So,
Big question.
ladies for the Community Foundation, the Michigan Health CEnR, I wanted to give you guys a little bit of feedback for Spike who's applied to both of you guys.
You've got your flex portal, and I think you guys. do flex
We
portal.
do,
Wow.
we're switching
So-
to Salesforce.
So here's the issue. So with larger institutions like my health organization, I don't have the flex credentials. My grant officer does. And in order to submit an application, I need to actually see those prompts that are in flex, because if I use the documents that Michigan Health Endowment Fund provides with the request for proposals and everything, I will write a full grant proposal that doesn't fit into your forms. So if you can find a way, and so what I have done in the past is I did in one case get, I forget which of you guys, I got credentials that I wasn't supposed to get because my grant officer was supposed to have them. And I went through the portal and I didn't submit. I just went through the portal and I copied all of the prompts, and all of the word or character limits, put it into a Word document. So I knew what I was actually writing, because that's the proposal that gets submitted. And that's what the grant writer needs to write, not the touchy-feely call for proposals that emphasizes different things and doesn't tell you what the word limits are.
That's probably your institution though, because
Yeah.
those
Yeah.
credentials to everyone.
Yeah, we get access to anyone who wants.
But I
But
think
it-
writing in Word is the best way.
I also had a problem that getting the credentials can take like a week or two. So it adds.
I'm sorry to hear that our turnaround needs to be much sooner, much quicker than that.
Having the word limits, having the actual prompts up front is a lot easier.
Yeah, I would talk to your institution too, though, because I'm obviously a grant writer. And I'm the one who has our access with both of you. I have control of both of yours. So, I think it might be yours.
Susan's the boss of us.
Everybody's the boss of Susan, though.
Maybe we just
So
include the character limits in the
generalized thing is,
application.
early on in the grant process, actually make it so that people can see what they're gonna be filling in for the final.
Yeah. Oh, that's great.
Even the other agencies, even the NIH is great enough.
Questions are in the RFP. They are all of our questions from the application are listed on the RFP, but to your point, it doesn't say what the character limits or tell you, yeah.
I will just tell you that our grant manager goes to a national conference, and this is the conversation with the grants managers across the country right now, is how to, now that everybody's digital, how to make it how to make it easy and friendly for organizations. So I'm just saying,
They're working.
I hear your
So
pain.
the other feedback I would give you guys, this is for everybody, is I heard each of you say do your homework and make sure you understand the mechanisms. It took me 2 weeks to get through Michigan Health Endowment. To really understand your different sections, I'm sorry, but it's really hard to differentiate and figure out how this one's different. This one, there's a lot of coded speech, but for somebody who's not in the grants, in the grants office, in the grants writing world, somebody who's actually on the ground doing the research or delivering service, we're not thinking in those phrases that you guys get. And it takes forever to do the homework and understand in depth, and this is why we call it the program officers is, I don't understand what you wrote here. Does you think what you had in mind?
That's great feedback. Thank you for that.
Totally.
And now we're gonna turn it over to Dr. Haley Thompson.
Back on that, I know that, jargon is, specific to every area. I know that we've done things, Courtney has been a program officer for our projects a couple of times, and we've done workshop on PCORI, what it is a jargon. It's not even jargon, it's a culture. PCORI is a culture, actually, in terms of patient-centered outcomes research and the language things and what they mean. They have different, their website is so in-depth in terms of, resources and materials. So I appreciate what you're saying, like, we have to really understand that language. I feel like every funding organization has their own language, ideas, and frameworks. And you have to understand it if you want to be competitive for that funding agency. And that's
I'll do that homework for $1 million grant. I won't do it for $50,000 grant. It's too much work. When it's that.
So I will leave it at that. And, but actually, can you guys join me? I know we've done a lot of applause today, but can you guys join me? Which you're taking time to talk to this group. It's been really helpful. It's been really stimulating in terms of just even thinking about how to move forward with different ideas. I'm sure everybody in the room and everybody online got a lot out of it. So at this point, before we leave, I just want to turn it over to our staff And then I wanted to thank Alex Back and Kanaya Kinney and Michaela Harrison and Asana Rinky and Zachary Session back. These are some of our 4 folks who helped put this together, as well as our partner CEnR. Thank you for everything this evening. I'm going to turn it over to Alex so she can tell you about the evaluation and our next program, our next workshop. Thank you.